Hello everyone, welcome back to Dr.shil's Physio Victory. In this video, we are going to discuss previous year questions of RRB 2019. These questions are extremely useful for your upcoming government exams. So, let's begin. Today's first question is: red muscles do not go into fatigue mainly because of option A, low myoglobin level, option B, aerobic metabolism, option C, high creatinine level, option D, anaerobic metabolism. The correct answer is option B, aerobic metabolism. Aerobic metabolism occurs in red muscles, also known as slow twitching muscle, red muscles, or slow twitch muscles, or is also known as type 1 muscles. They are rich in mitochondria, myoglobin, and capillaries, which support sustained aerobic metabolism. This process uses oxygen to efficiently produce ATP over long periods, preventing rapid buildup of lactic acid and fatty. Next, come to question number 2. An electrical transformer works on the principle of option A, conduction, option B, electromagnetic radiation, option C, electromagnetic induction, option D, rectification. Here the correct answer is option C, electromagnetic induction. Basically, transformers operate based on Faraday's law of electromagnetic induction, where a changing magnetic field is the primary coil, which induces an electromotive force in the secondary coil, allowing voltage transformation without direct electrical connection. Conduction involves direct flow through a medium. Next, come to question number 3. Cells are enclosed by a plasma membrane composed mainly of option A, fats and carbohydrates, option B, lipids and proteins, option C, lipids and emulsified fats, option D, proteins and emulsified fats. This is a very basic question. The answer is option B, lipid and protein. The plasma membrane follows the fluid mosaic model. Primarily consisting of a phospholipid biliary embedded with proteins for functions like transports, signalings, and structures. Next, come to question number 4. Which nerve damage leads to paralysis of hemidiaphragm? Option A, ulnar nerve, option B, median nerve, Option C, phrenic nerve. Option D, vagus nerve. The correct answer is option C, phrenic nerve. Root value of phrenic nerve is C3, C5. Ulnar nerve and median nerve supplies upper limb, and vagus nerve affects parasympathetic function. Next, come to question number 5. The transfer of heat to an object by passage of fluid or air is known as option A, radiation, option B, conversion, option C, convection, option D, conduction. If there is a medium, then it is called convection. So the right answer is option C, convection. In conduction, there should be a direct contact. And radiation is electromagnetic wave. Next, come to question number 6, which is universally used for preparing solid media. Option A, agar. Option B, urine. Option C, blood. Option D, NaCl. The correct answer is option A, agar. Agar derives from seaweed. Is a gelling agent used in microbiology to solidify nutrient media for bacterial growth, as it remains solid at incubation temperature and is inert. Next, come to question number 7, which includes late fetal and early neonatal death. Option A, primary mortality. Option B, stillbirth. Option C, fetal death. Option D, infant mortality. Here, the correct answer is perinatal mortality. Perinatal mortality encompasses stillbirth, late fetal death after (28) weeks, and early neonatal death within first 7 days post birth. Stillbirth is only fetal death. It is only fetal death Fetal death is excludes neonatal death and infant mortalities covers up to 1 year. Next, come to question number 8. Occupational lung disease due to sugarcane dust is option A anthracosis, option B byssinosis, option C farmer's lung, option D babesiosis. Here the correct answer is option D babesiosis. Babesiosis is a hypersensitivity pneumonitis. The pneumonitis from inhaling moldy dust of sugarcanes causing lung inflammation. Anthracosis is from coal dust, byssinosis from cotton dust, farmer's lung from hay mold. Is a fungal infection. Next, come to question number 9. Investigation to characterize epilepsy. Which investigation generally used to characterize epilepsy? Option A chest X-ray, option B ECG, option C EMG, and option D EEG. Here the answer is EEG. ECG for cardiac abnormality, EMG for muscle abnormality, chest X-ray for lung abnormality. Next, come to question number 10. Incision for partial thyroidectomy. Option A collar incision, option B midline incision, option C Morris incision, option D Kocher's incision. Here the correct answer is option A collar incision. Generally it is used just upper to the sternal notch in a natural skin. Midline incision is used for abdominal surgeries. Morris incision, not any kind of incision. Kocher's incision is generally used for bowels and liver. exposure. Next, come to question number 11. Rotational deformity of cervical spine causing head tilt. Option A, cervical spondylosis. Option B, thoracic outlet syndrome. Option C, cervical disc syndrome. Option D, Rhineck. Here the correct answer is option D, Rhineck. Next, come to question number 12. Joint showing pendular movements, chiefly. Option A, atlanto-occipital joint. Option B, shoulder joint. Option C, temporomandibular joint or TMJ. Option D, atlanto-occipital joint. Here, correct answer is option B, atlanto-occipital joint. So, atlanto-axial joint is atlanto-occipital joint. Atlanto-axial joint only shows rotation. Other joints are basically temporomandibular is allowing hinge and gliding. Atlanto-occipital is flexion, extension or nodding. Next, come to question number 13. Ability of eye lenses to adjust focal length is called option A, magnification. Option B, accommodation. Option C, modulation. Option D, focal length. The correct answer is option B, accommodation. Accommodation is a process where ciliary muscles contract to change the lens curvature, thicker for near vision, and thinner for far vision. Magnification is related to image sizing. Modulation is basically unrelated. And focal length is a static property. Next, come to question number 14. Which is not a method of data collection? Option A, warranty card. Option B, interview. Option C, logical analysis. Option D, schedules. Here the correct answer is option C, logical analysis. Logical analysis is a method of data interpretation. It is a method of data interpretation, not a method of data collection. Next, come to question number 15. Color of synovial fluid in rheumatoid arthritis. Option A, green. Option B, white. Option C, colorless. Option D, yellow. Here the correct answer is option D, yellow. Basically, the normal synovial fluid color is colorless, is normal fluid, and green for basically infection, and white or milky for gout or pseudo gout. Next, come to question number 16. Fracture of distal radius with ulnar dislocation is called option A, Galeazzi fracture, option B, Monteggia fracture, option C, Colles fracture, option D, Smith's fracture. Here the correct answer is option A, Galeazzi's fracture. Galeazzi's fracture involves fracture of distal one third of radius with dislocation of distal radioulnar joint. Monteggia is proximal ulnar fracture. It is proximal ulnar fracture with radial head dislocation. Colles fracture is distal radial fracture of distal one third of radius with dorsal angulation, and it is Smith fracture is volar angulation of distal one third of radius. Next, come to question number 17. Non-thrust mobilization with large amplitude oscillation is graded as option A, grade 4, option B, grade 2, option C, grade 1, option D, grade 3. Here the correct answer is option B, grade 2. Grade 1 is small amplitude mid-range for pain relief. Grade 2 is large amplitude mid-range not reaching the limit for pain and early mobility. Grade 3 is large amplitude up to end range for mobility. Grade 4 is small amplitude at end range for stretching. Next, come to question number 18. Overexposure to UV radiation increases sensitivity to option A, wind, option B, cold, option C, touch, option D, sunlight. It is a very one-liner question. Answer is option D, sunlight. Next, come to question number 19. Electrical stimulation which compression for edema is used. Option A, Faradic foot bath. Option B, iontophoresis. Option C, Faradism under pressure. Option D, galvanism. Here the correct answer is option C, Faradism under pressure. It is used basically for reducing the edema. There is pumping effect is the most important thing, while the limb is elevated and wrapped in compression bandage to reduce edema. Iontophoresis actually delivers drugs galvanism uses constant direct current. Faradic foot bath is for intrinsic foot muscles. Next, come to question number 20. Strong lateral lean toward hemiplegic side is called option A, locking syndrome, option B, pusher syndrome, option C, general adaptation syndrome, option D, Valiant syndrome. Here the correct answer is option B, pusher syndrome. Pusher syndrome occurs in stroke patients with basically right hemisphere lesion causing active pushing towards the hemiplegic side due to impaired perception of body orientation, leading to poor balance and resistance to correction. Lock-in syndrome basically is near total paralysis or quadriplegia plus anarthria due to brainstem lesion. Patients are fully conscious but can only communicate via vertical eye movement or blink. No active pushing or leaning component is there. General adaptation syndrome occurs in Hans-Selin's model of physiological stress response. Model of physiological stress response. Next, come to question number 21. Movement of bones rather than articular surface is called option A arthrokinematics, option B osteokinematics, option C joint mobility, option D motion. Here the correct answer is osteokinematics. Osteokinematics is movement of bone. Arthrokinematics is movement of articular surfaces. Joint mobility and motions are general term. Next, come to question number 22. Muscle with common active trigger points. Option A biceps brachii, option B abdominals, option C serratus anterior, option D sternocleidomastoid. Here the correct answer is sternocleidomastoid. Next, come to question number 23. Who discovers penicillin? Option A Robert Koch, option B Alexander Fleming, option C Watson and Crick, option D Edward Jenner. Very basic question. Answer is option B Alexander Fleming in 1928. Watson and Crick discovers DNA structure. Edward Jenner discovers smallpox vaccine. Robert Koch discovers tuberculosis bacillus. Next, come to question number 24. Sprengel's deformity is cleidocranial dystosis, option A, option B radial club hand, option C congenital elevation of scapula, option D radioulnar synostosis. Here the correct answer is option C congenital elevation of scapula. Next, come to question number 25. Peripheral neuropathy generally seen in option A diabetes mellitus, option B myocardial infarction, option C cerebral palsy, option D stroke. Here the correct answer is option A diabetes mellitus. In diabetes mellitus, generally diabetic peripheral neuropathy is common complication from chronic hyperglycemia damaging the nerves. Next, come to question number 26. Overstretching results in option A tightness, option B hypermobility, option C flexibility, option D hypomobility. Here the correct answer is option B hypermobility. Next, come to question number 27. Muscles supplied by two nerves with different roots. Option A, flexor pollicis longus. Option B, flexor digitorum superficialis. Option C, flexor digitorum profundus. Option D, pronator teres. Here, the correct answer is option C, flexor digitorum profundus. It has a dual nerve supply, lateral half by anterior interosseous nerve, root value C8 T1, which is a branch of median nerve and medial half by ulnar nerve, root value of C8 T1. Next, come to question number 28. IFT frequency to absorb exudate. Option A, 80 to 100 Hz constant. Option B, 1 to 10 Hz constant. Option C, 80 to 100 Hz rhythmic. Option D, 1 to 10 Hz rhythmic. Here, the correct answer is option D, 1 to 10 Hz rhythmic, generally used to drainage and exudate absorption in edema. And 50 to 100 Hz rhythmic is for pain relief. Next, come to question number 29. Ventricular fibrillation treated with defibrillation with energy of option A, 500 joule, option B, 400 to 500 joule, option C, 100 to 400 joule, and option D, 1000 joule. Here, the correct answer is 100 to 400 joule. In modern biphasic defibrillation, defibrillators uses basically 120 to 200 joule. Next, come to question number 30. Technique for joint limitation due to soft tissue shortening. Option A, passive range of motion. Option B, stretching exercise. Option C, suspension therapy. Option D, active range of motion. Here, the correct answer is option B. Stretching exercise generally are used to treat joint limitation due to soft tissue. Range of motion exercises are generally used for maintaining existing range, and suspension therapy is used to assist movement by a sling, or it is an assistive movement. Next, come to question number 31. Milk-borne organisms destroyed by option A, cooling, option B, heating, option C, adding sugar, option D, pasteurization. Correct answer is option D, pasteurization. Pasteurization, the technique of heating milk at 72 degrees Celsius for 15 seconds to kill pathogens like Salmonella, E. coli. Cooling generally slows growth. Heating is vague basically. Adding sugar is for preservation. Next come to question number 32. Confirmatory test for HIV. Option A, HbA1c. Option B, Mantoux test. Option C, Western blot test. Option D, Valère-Rose test. Here the correct answer is Western blot test. This is basically used for screening or ELISA. HbA1c for diabetes. Mantoux test for TB and Valère-Rose for rheumatoid factor. Next come to question number 33. Drug for anaphylaxis in inflammatory conditions. Option A, acetate. Option B, hyaluronidase. Option C, dexamethasone. Option D, zinc. Here the correct answer is dexamethasone is a corticosteroid. Hyaluronidase is used for edema. Zinc is used for ischemic ulcer. Acetate is used for calcific deposits. Next come to question number 34. Normal recovery time after Bennett's fracture. Option A, 4 to 6 weeks. Option B, 12 to 14 weeks. Option C, 10 to 12 weeks. Option D, 3 to 4 weeks. Here the correct answer is 10 to 12 weeks after injury. Basically 6 to 8 weeks for fixation and 10 to 12 weeks basically for full grip or pinch grip function after progressive therapy. Next, come to question number 35. First aid for nasal bone fracture. Option A, steady the head. Option B, clear the airway. Option C, cold compression. Option D, both B and C. Here, the correct answer is option D, both. First, you have to clear the airway, then you have to give cold compression to reduce swelling and pain. Steady head basically is for suspected cervical injury. If there is suspected cervical injury. Thank you everyone for watching this video and stay tuned for next part of RRB previous year questions. Please do like, subscribe and share my video if you feel that it is useful. Thank you.